Good afternoon. Welcome to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang. Senator Nguyen. Here. Senator Stone. Here. Senator Titus. Here. Chair Donate.
And I am here. Please mark Senator Lang present when she arrives. She's on her way. Good evening, everyone. Welcome to today's hearing on Senate Bill 42 and 117. As always, we have a few housekeeping items that I'm going to go over first before we get into the hearings. We don't have any presentations today, so we'll see how fast the meeting can go. I promise I try to make us go as efficient as possible. Just as housekeeping items, agenda items may be taken in a different order than listed. For those of us that want to participate in public comments, we ask that public comments be kept to 2 minutes so that everyone interested can have the ability to speak in a timely fashion. If you don't have the opportunity to speak in public comment, you can always send your comments in writing in addition to testifying or in lieu of thereof. If you wish to testify, you can always sign in at the table by the door. And just as a reminder that when testifying, please turn on your microphones on and off, on to speak and off to listen. We have listeners and viewers both in Las Vegas and virtually, so we want to make sure that everything is captured. And then a reminder to all those who testify that it is unlawful for a person to knowingly misrepresent facts when testifying before a legislative committee. I think that was the headline of the week this week for some of the bill hearings. And finally, please turn off your electronic devices, especially cell phones and laptops, throughout today's meeting. We'll go ahead and start with Senate Bill 42 first, and then we'll move on to our other bills. So let's go ahead and open the hearing on Senate Bill 42. This bill revises provisions relating to the funding of medical assistance to indigent persons. We have Ms. Joanna Jacobs from Clark County, so please begin when you're ready, ma'am.
Thank you, Chair Donate and members of the committee. Joanna Jacob, Government Affairs Manager. Good afternoon to you all. I'm very pleased to be before you for the first time this session, and we are presenting one of Clark County's sponsored bills. SB 42 is intended to allow the county additional flexibility to contribute indigent care dollars to supplemental payment programs that go to support UMC operations. UMC, in case the committee does not know, is our county public hospital. The Clark County we contribute financially to UMC. We fund UMC. So we currently pay the state match, meaning the non-federal share, for supplemental payment programs that are various programs that are approved by the Federal Centers for Medicare and Medicaid Services. These payments operate to supplement, meaning that they're in addition to regular billable reimbursement rates, but they supplement those billable reimbursement rates, so they're in addition to the base Medicaid reimbursement rate. So we have a variety. These types of supplemental payment programs exist. They usually are payments to providers for a variety of programs. We have ones at UMC that fund GME. We fund inpatient services, outpatient services, and then we've been working on some other types of programs that have come into availability from the federal government, and this is the genesis of the bill. I want to talk about, because we're talking about indigent care dollars, I want to talk about this just really briefly for background. 10 cents on every $100 valuation for our property tax is devoted to indigent care, and that's the funding stream that we're talking about when we're amending this statute. It's not, generally, it does fund supplemental payment programs to UMC, but we also pay with this funding the non-federal share to Medicaid for long-term care for indigent patients. So indigent, what does that mean? We follow the guidelines in the statute. It's NRS 439B 310, and it really means anybody who's not covered under health insurance. So it could be largely people who don't have health insurance or are not eligible for health insurance, or who are ineligible for our Medicaid programs. They're really low income when you have to spend dollars down, for example, in long-term care, and also generally Medicaid, our Medicaid population, and that's really how we use this fund. UMC's indigent caseload under this metric, our total patient mix, I just checked this week, we are at about 43.9% Medicaid of our total Medicaid population. Self-pay, meaning for a variety of reasons, no insurance source that we can use and not eligible for Medicaid is about 5%. So we're looking at about, on average, about 50% of our caseload with our UMC caseload is this indigent population. So that is why we are asking for this change. NRS currently permits these indigent dollars to be contributed to specific supplemental payment programs. And this statute that we're amending, you'll see in the bill, it applies to counties who are over 100,000. So that means Clark and Washoe County are eligible to participate in this. We are wanting, right now, the statute was limited, and it said we can contribute to certain supplemental payment programs, which really was our DISH program and the upper payment limit programs, which I mentioned, inpatient services and outpatient services historically. We have been working with the state and with UMC. There's been additional opportunities to do supplemental payment programs, which are not referenced in this statute, and including one which helps UMC in our managed care contracts get closer to a commercial rate. It's called a directed payment program. It is approved by CMS through a type of approval process where we submit a plan to the federal government, and it is approved. In exchange for us doing performance metrics and everything, we can get an enhanced rate on top of the MCO payments. So that is why we're seeking this change. We'd like the additional flexibility. We have a longstanding partnership with the state of Nevada, HHS, on these supplemental payment programs, and we would like the flexibility to use those dollars in appropriate programs that are approved by CMS with the amendment. The amendment that is before you in Nellis, hopefully, that hopefully everybody has. The original language we had said any supplemental payment program approved by Medicaid. We came upon a real technicality that we ran into. Our whole genesis of this bill was to be able to contribute to this directed payment program. It's not in the state plan for Medicaid. It's approved through this alternate process, approved by CMS, because it operates in a different way. So we worked with HHS on this amendment to say we'd like to just limit it to, or we would like to say approved by CMS in some way that'll cover things that are approved in our state plan for Medicaid, but also through these alternate approval processes in the federal government. So that's really the genesis of this bill. We would like the flexibility to enter into arrangements with the state of Nevada to continue to pursue these supplemental payment programs for UMC that helps to ensure the financial viability of UMC. And then I did want to put on the record, because I think that there is a variety of programs that we have. So I want to make sure that it is very clearly stated in the minutes that this funding is a separate source of funding from a separate fund that is called the Fund for Indigent Care for Hospitals. This fund is actually in a separate section of the statute under NRS 428-206, and it's a separate pot of property tax. So it's 1.5 cents per $100 of valuation that goes to that fund, and that operates in a different way to help hospitals pay also for the cost of delivering care to the indigent. This change that we have in the bill does not impact that funding, and I wanted to say that for the record. That's really it, Chair Donate. I know supplemental payment programs are something that we have talked about in this committee in past legislative sessions, and they are really just a way for us to contribute our Clark County General Fund, partner with the state, and then work with the federal government to bring back more than we contribute to support our hospitals, and that's why we are seeking this change. And the effective date on this bill will be July 1st, if it should pass. So that is my presentation, and I'd be happy to answer any questions from the committee.
Thank you so much. Any questions? Senator Titus.
So just for the record, it doesn't affect any other public hospitals, especially rural areas. It's strictly related to Clark County, and there's only one public hospital in Clark County?
That's correct.
And having said that, what about all the other hospitals in Clark County that do see Medicaid patients? They walk into the ER, they take care of them. Will it impact their reimbursement for that?
Thank you for the question, Chair Donate, through you to Senator Titus. We did send this language to the Hospital Association. One of their questions was about that fund for indigent care. That is a separate value, the separate stream of funding, and that fund is not touched. It is a dedicated fund that we also work with the Nevada Association of Counties to administer that fund, and that helps hospitals pay for that care. This should not impact those hospitals.
Great, thank you.
Thank you very much.
Thank you, Mr. Chair, for the questions.
Thank you so much. Any other questions? Senator Stone.
Thank you. Thank you for your presentation. Could you just elaborate a little bit more on the supplemental payment? And is that supplemental delta, is that what we're leveraging with the federal government to get more funds back? Just want to make sure I'm understanding it right.
Thank you for the question. Through you, Chair Donate, to Senator Stone. Excellent question. Yes, that's exactly what
Name
we're
for the
talking.
record, please.
Thank you. Joanna Jacob, Government Affairs Manager. Thank you, Chair Donate, for the reminder. Joanna Jacob, Government Affairs for Clark County, for the record. And yes, that's exactly how these plans operate, that when I said we get more than we contribute, we put in the funding, and then we are able to partner. There's a supplemental payment that can come down. We get more, and Clark County has entered into this longstanding arrangement with the state because it benefited UMC. If we were able to bring in additional funds that brings them up closer to the delta, if you will, that typically closer to what Medicare would pay. And in the case of the directed payment program, it's really an innovative program that actually works to try and bring them up closer to actually a commercial rate. So this is where we are contributing funds, but then we're bringing back more that will benefit the hospital. And I hope that answered your question.
Thank you so much. Any other questions? I don't have any. Thank you so much. We'll go ahead and close this presentation, and we'll go to testimony in support of Senate Bill 42. Just as a reminder, if there's anyone here that would like to provide public testimony, to limit it for 2 minutes each, we'll go ahead and start with testimony in support in the physical location. So is there anyone here that would like to provide? Let's go to Las Vegas or virtual. BPS, is there anyone virtually that would like to provide support testimony at this time?
Chair, there are no callers at this time.
Thank you so much. Is there anyone in Carson City that would like to provide testimony against in opposition for Senate Bill 42? We don't have any BPS. Is there anyone virtually or in Las Vegas?
Chair, there are no callers at this time.
Thank you so much. And then last but not least, is there anyone in neutral on this measure? We don't have anyone here. BPS, is there anyone virtually?
Chair, there are no callers at this time.
Thank you so much. We'll go ahead and close the testimony. Ms. Jacob, did you have any closing remarks?
I know time is short, so I just want to say thank you to the committee members for the hearing today and for your questions. And I appreciate all the questions that you asked me. Thank you very much.
Thank you so much, ma'am. We'll be sure to keep in post with any future considerations of this bill. Okay, I will go ahead and close this hearing on Senate Bill 42. Let's move on to Senate Bill 117. So I'll go ahead and open the hearing for this bill. This bill revises provisions relating to the community health workers. Today we have Mr. Jay Colbert, who's a program manager at the Nevada Community Health Workers Association. So please proceed, and welcome back to the legislature.
Thank you so much. It's good to be here in person. So Jay Colbert Classell, for the record, from the Healthy Communities Coalition of Lyon and Story County. And I got so used to Zoom that this is going to be a little trickier for me. Is this where I do the USB? Okay. And I have a printout of the slides for anyone who would like that, and it also has my contact information on it. All right, well, while this machine boots up, I can begin sharing a little bit about SB 117. So in the last session with AB 191, Nevada began reimbursements for CHWs to provide chronic disease prevention and chronic disease management for clients. CHWs are approved through CMS, through state plan amendments. Let's see. And the multitasking Do I need a password for this? Oh, there it goes. It connected. Perfect. And I do have a vision impairment, so that's a little challenging for me.
Let me know. Is it a PowerPoint?
It is.
Okay. Then open the file and press F5.
No, I think Control L might. Oh, it opened in a different program. Okay. And then, did that share the screen?
F5.
I will try to open it with.
Recess for a minute.
1 minute recess, please. Welcome back to recess. Please proceed when you're ready. The mic, please. There you go.
There we go. Jay Colbert Classell, for the record, from the Community Health Worker Association at the Healthy Communities Coalition of Lyon and Story Counties. It is. Adventures in Tech. In person actually brought it back. So in Nevada, we have an 8-week CHW program. Many CHWs do a more advanced track, but all of them cover these 13 CHW competencies: advocacy skills, community outreach and engagement, communication skills, promoting healthy lifestyles, cultural competence, service coordination skills, individual and assessment skills, health insurance basics, teaching skills, organizational skills, community capacity building, professional conduct, and interpersonal skills and public health. So for supervision, what we find internationally is that CHWs need to be supervised. They've had 8 weeks of education, and so their role is to bring cultural expertise from the communities that they're from. And the supervisors are able to provide resources and help support them so they can send people to the referrals and communicate those referrals and ways of being in a way that will be accepted by the community. One of the big questions in Nevada is, well, how do we recognize supervision so that we have quality programs in Nevada? And Nevada started with the medical settings model. So right now, physician assistant, or APRNs, can supervise CHWs that are providing services inside and outside of the clinic. That's actually inverted to how most states went about this. They began with social workers or more behavioral health positions supervising their CHWs. So what other states have kind of been growing into is identifying licensed professionals as those professionals that we submit to CMS for CHW service reimbursement. In Indiana, they do under the supervision of a qualified provider. You have Oregon supervision of licensed providers. So this is the normal language that we see around the country. Like in New Mexico, they prohibit CHWs from doing the work of licensed professionals. We do that here as well, in addition to not accepting CE credits that are meant for licensed professionals, because it might give the CHW the impression that they are should be doing something that they're not actually licensed to do. And then some states have required CHWs to be included. That wasn't necessary in Nevada because the MCOs and the community had a ground-up adoption of CHW work. All the MCOs had CHWs long before we had licensing or formal education or certification. And so we think that Nevada can skip that step, and that's one reason why that requiring the MCOs to have CHWs is not in the bill. So CHWs have a code of ethics that they sign. So you have some of this terminology. I won't read through all of these. And the supervisors need to know this code of ethics too, so that they ensure that their CHWs are assigned to things that are within their scope of practice. We have many training programs in Nevada, and that's expanding quite dramatically. So High Sierra AHEC is the newest program with high school students and some who are in the healthcare pipeline and really looking at advanced careers. The CHW Association has about 120 students per quarter now, so we've grown quite substantially and have a pretty diverse student base. For CHWs in the state, it may be the most diverse medical training program, with about 24% of the students African American or Black, about 40% from the Hispanic community, and we've had a large expansion with tribal clinics now, because Provider Type 47 was added to the state plan amendment in December, and that is 100% reimbursed at the FQHC encounter rate again, with either the FQHC or the other designation, which I don't recall right at the moment. The TMCC program will accept students at any time. So they're structured differently. We're based off quarters, or the other programs are based off quarters. TMCC students can sign up at any time. So if somebody really needs to get their certification and start the journey, that's the place to go. So our newest cohort, we did a completely in-person class at the center, which serves LGBTQ+ in Las Vegas with 14 students, and it happened to be on the same day this bill was introduced. So what this bill does is it recognizes the Nevada Certification Board and the NRS. The CHW education began in Nevada before we had certification. So this goes back and addresses that the certification comes from the Nevada Certification Board. Secondly, it allows Medicaid with CMS approval to add qualified supervisors in addition to the physicians, PAs, and APRNs. And then there was a fiscal note, which I'm hoping to discuss and get some clarity, that was just recently added. The Nevada Certification Board does investigations. So I don't know if an amendment just to remove that $500 potential fee or just restructuring that portion. Actually, I'll just hop to this next one. Addressing section 1.2. So if a CHW, or somebody can say they're a CHW, anyone can say I'm a community health worker, they can go through the education, but to be a certified community health worker, you have to go through the Nevada Certification Board. And once you're with the Nevada Certification Board, they're the ones who are monitoring, are you getting your CEs done? They assign a number that has to be logged with Medicaid for reimbursements. And so that's where all the accountability is. Complaints about CHWs are submitted to the Nevada Certification Board that then investigates. And largely, CHWs have been voluntarily coming in and getting certification now that it's available. So we have 302 certified CHWs, and you know what, I wrote down the number so I wouldn't misspeak, 64 CHW2s, which about 40 of those have been in the last year. So that really shows how many have stepped up to that additional layer or level. And then Section 2.3 limits Medicaid reimbursement for CHWs under the supervision of approved providers of healthcare. So those approvals would mostly go through state plan amendments, although there are other methods, as was just discussed in the previous presentation. So here's my contact information. I wanted to emphasize the roles between the Nevada Certification Board and the association. So the association is really focused on education, getting students trained, and then the Nevada Certification Board is actually doing that accountability. We have additional references, and then the supervision references are all new. I haven't presented these before, and they were provided by Elisa Howard, who's one of our instructors in Las Vegas.
Thank you so much. We'll go ahead and go to questions. Dr. Titus, Senator Titus.
Thank you, Mr. Chair. I appreciate the opportunity to ask a question. Thank you for the presentation. Glad you were able to wade through the technical difficulties. I have several questions, actually. So it's an 8-week training program that is offered in Nevada. You said there's other programs offered, but the state offers it, or who offers it?
Thank you, Senator Titus, through you, Chair Doniete. These are the training J. Colbert Class L for the record. Almost got all the words. These are the training programs in Nevada. So the state does not have a training program. The state did not have the funds to set up an entire association. And so the Healthy Communities Coalition of Lyon and Story County volunteered to pick up that role. We initially started with a small grant from the state, and we now have 6 different grants. I am pleased to announce that we have a new HRSA grant that we partnered with Intermountain Health, and for Nye, Esmeralda, and Lincoln and Clark students, we'll be able to offer a living stipend and a significant amount of additional support, and that application will open today. So because of that, the DHHS wrote us a letter kind of saying, if you're going to make any significant changes to this curriculum that we developed, run it by us first.
So just back to my question. So it's an 8-week program, but it's not online. It has to be in person, located on a campus somewhere?
J. Colbert Class L for the record, through you, Chair Doniete. We have a hybrid online program. We have completely in-person programs.
And is that the standard nationwide, 8 weeks?
J. Colbert Class L for the record, through you, or done yet? I'm going to get good at that someday. It's 8 to about 15 weeks nationally.
You used, thank you. You used terms like scope of practice and medical training. And one of the things that I see, and I've had concerns, I support community health workers, but my vision of a community health worker is not a scope of practice and medical training as much as more of the model where the social workers used them, because in my idea, they don't practice medicine nor give health care. They are somebody that assesses a patient within their own environment. Are they taking their medications? Do they have food in the refrigerator? Do they have a doctor's appointment? How do they get to their doctor's appointment? That social networking that's so critical to the care, the overall well-being of folks. And so just to have some concerns about the identity of that when you're using term scope of practice and medical training, because they don't really change dressings, they don't really do blood pressures, they don't really do any of the medical component, more of a social well-being component. Could you clarify that for me?
Yeah, J. Colbert Class L for the record. That is correct. There's no such thing as a medical CHW. We have CHWs in medical settings. And there are additional trainings. So someone may be trained to do blood pressure self-management and teach somebody how to do that. But that would be additional training on top of this.
Okay. And then, thank you for that. Then you mentioned the back to the bill itself, and I'm looking at section 2, number 2. The director may include in the state plan for Medicaid. You're not interested in saying shall include, so what if they decide not to include this at all?
J. Colbert Classell for the record. It's largely driven by CMS policy. And so it's giving them permission to follow the CMS guidelines that are being put out.
But you're already, and just to be clear, you already say the director may include the state plan and requirement to the extent authorized. So I worry that you've already, to the extent authorized, you might consider shall include it to the extent authorized as opposed to may, because there's no, why would they do this at all? They might do it, they might not do it, but there's no instance where I see that they have to do it. And they're going to have to work within the CMS guidelines. They're going to have to work within the federal guidelines, and you clarify that. But I worry about terms like may versus shall. So thoughts on that?
J. Colbert Classell for the record. We would support that under guidance from your policy analysts if there was anything that I was missing.
Final question, if I might, Mr. Chair. You mentioned the licensure of something like, how much is it to be licensed for a community health worker? Did you say something like $500?
J. Colbert Classell for the record. The class is available for free if the CHW doesn't have funding for it. Most programs are under $1,000. Our program costs $300 per student to implement. Then they submit that education credential to the Nevada Certification Board, and a CHW1 pays $75 the first year, and then $50 every 2 years after that. And a CHW2 pays $150 for the first year.
Sorry, Mr. Chair, I said last question, but I have one more if I might. So my last question is on your list, your litany, your laundry list of what they're trained to do, that 10 programs. You didn't mention anything about education on HIPAA violations. Is that part of that training, I would hope, about the confidentiality and the HIPAA laws? Is that part of the ethical training, or where is the HIPAA rules with these community partners?
J. Colbert Classell for the record. All CHWs who are serving in a medical setting must take a HIPAA training. We recommend it for everyone, but we didn't redevelop a HIPAA training since there are so many out there.
And that's not part of the eight-week program? That's on top of the 8-week program? All right, thank you. Thank you, Mr. Chair.
That's a lot of final questions. I'm just joking. One quick question that I had was just in terms of the general trends. I did research as to how many states have enacted this, and we talked about this as part of the COVID-19 recovery. Do you believe it's the reasoning was as to why states have pivoted towards the licensure of these folks is because it's recognizing just how impactful they can be in healthcare, but we also want to make sure that they're also receiving the right amount of training? Is that why some states have enacted these licensure processes for these folks, or what are some of the trends that you're seeing in terms of personal feedback as to why it's necessary or relevant?
Yeah, J. Colbert Classell for the record. Just a quick clarification. It's a certification, not a license. I've gotten myself into trouble misspeaking on that one as well. So like a social worker has so much more training than a CHW, but a CHW has invaluable experience from the community. So they can help translate a food pyramid to foods that would be relevant. And what we've just seen is that CHWs save $2 for every dollar spent in Nevada. Other states have seen higher savings from these programs.
Thank you so much. That was pretty much the clarification that I was looking for. Senator Stone.
Yeah, thank you. Thank you, Mr. Cobell, for your presentation. Are there any educational requirements, a high school education, in order to take this 8-week course, or can anybody just go through the 8-week course? And is there an exam at the end of the 8-week course, or is the certification just by completing the course? And is there CE required every 2 years to maintain their certification?
J. Colbert Classell for the record. CHW1 does not require a high school equivalent to pursue, partially because we are training high school students. And then we help and encourage those CHWs to get that certification. Any medical setting is going to require a high school equivalency for working in that setting. The CEs are available on the Nevada Certification website.
And how about the number 2s?
J. Colbert Classell, for the record, CHW2s are required to have a high school equivalency.
Okay, and again, just passing the class is a certification. There's no exam that you have to pass in order to become certified, is that correct?
J. Colbert Classell, for the record, the CHW1 does not have an exam. The CHW2 will have an exam in the future.
Thank you very much.
Thank you. And just fun questions, because I think this is important. Do you have a note of the average hourly wage that CHWs could make in the state? Is that something that you know from the top of your head?
J. Colbert Classell, for the record, they vary from $14 an hour all the way to around $30.
That's pretty significant for public health. And then from the percentages of the folks that you know, are many of the CHWs right now in rural areas? Is that usually where we've been piloting most of these folks? Or what's the general composition?
J. Colbert Classell, for the record, we have students from every single county in the state, and it's about a third rural.
Thank you so much. Okay. Any other questions? No. Okay, I think we're good. We're going to go ahead and move on to testimony in support, opposition, and neutral. I do know that we have a friendly conceptual amendment, which we will get to for the committee members when we get to neutral to present on that, and we'll allow for questions as well. So let's go ahead and proceed to hear testimony in support of Senate Bill 117. Once again, as a reminder, to please limit your comments to 2 minutes each, and if you have any additional comments, you can always send it to our committee staff. So is there anyone in the room that would like to present in favor of Senate Bill 117? Please proceed when you're ready.
Thank you, Mr. Chair, members of the committee. My name is Joan Hall. I'm the president of the Nevada Rural Hospital Partners. I've been working on committees for about a decade now on community health workers. I'm glad to see it progressing. COVID shone a light on the need for non-typical care providers. Community health workers fill that need. They also have the cultural competence of the communities that they're serving, whether it's Native American or Hispanic populations. We believe that this is a really great move to be able to provide Medicaid reimbursement for them. We also see CHWs as a key component to workforce development, as this is kind of a starter area for people that maybe want to progress into nursing, social work, or even medical services. So we're in support of this bill. Thank you.
Thank you so much. Anyone else? We don't have anyone else please proceed. Yep.
Thank you, Chair. Members of the committee, I'm Andrea Gregg. I'm the Chief Executive Officer of High Sierra AHEC. We are a healthcare workforce development organization located in Reno, servicing all 17 counties across the state through our sister AHECs. And as our colleague Jay mentioned, we do have a training program that we offer through our organization. We're the first in the state to implement the CHW certification for high school students. And really agree with everything Joan said. I think two things I wanted to share. We know that our program is really designed to eliminate social and economic barriers. We have trained 46 students thus far. A remarkable 47% of those do hail from rural areas, and an impressive 86% are part of an underrepresented minority group. So I wanted to share some of that data with you, and also reiterate what Joan Hall just mentioned of the opportunity that a community health worker may present in our rural and urban underserved communities, as we might have the opportunity to upward mobilize those students to help further fill some of the other areas where we know we are also in crisis mode. So on behalf of High Sierra AHEC, we are in support, and thank you for your time.
Thank you so much. Anyone else? We don't have anyone here. BPS, is there anyone virtually or in Las Vegas in support?
I'm in Las Vegas. One person in Las Vegas.
Please proceed.
Okay, thank you. My name is Sheila Bray, for the record, with the University of Nevada, Reno. That's spelled SHEILA space BRAY. The University of Nevada, Reno would like to express support for Senate Bill 117. Senate Bill 117 confirms regulations around community health workers and expands the opportunity for additional support and development for the public health workforce. We urge your support for Senate Bill 117. Thank you.
Thank you so much. BPS, is there anyone virtually that would like to provide support testimony at this time?
If you'd like to testify in support, please press star 9 on your phone to take your place in the queue.
Hi, this is Steve Messenger from the Nevada Primary Care Association. We represent the state's federally qualified health centers. And I just want to say ditto to everything that Joan and Andrea and Jay have said. We are in support of this bill. Thank you.
Chair, there are no more callers at this time.
Thank you so much. I think we have someone in the audience that would like to come forward before we move on.
Senator, thank you for your indulgence. My name is Helen Foley, and I represent First Med, which is a very large center in southern Nevada, an FQHC, Federally Qualified Health Center. There's a lot of programs that are currently in the works dealing with Clark County, the city of Las Vegas, not only looking at someone's home for health care, but also if they're in need of housing, if they're in need of other social services. And we're getting into all of that quite a bit. And we believe that these healthcare workers could be very valuable to First Med. We wanted to make sure about certain things as far as different things in the state plan that might affect supervision. I've talked to Stacy about it, and Stacy Weeks, and we are going to work cooperatively with them during that phase of the process. But we think that community health workers could be very valuable to all of Nevada, and specifically Southern Nevada. Thank you.
Thank you so much, Ms. Foley. Anyone else before we move on? We'll go ahead and move to opposition. Is there anyone in the room that would like to testify in opposition? We don't have anyone here. I don't see anyone in Las Vegas. BPS, is there anyone in opposition virtually?
Chair, there are no callers at this time.
Thank you so much. And last but not least, is there anyone in neutral? So we'll go ahead and start. We do have Ms. Katie Ryan to present a friendly amendment, and then from there I'll allow the committee members to ask any questions. So please proceed when you're ready.
Thank you, Chair, members of the committee. For the record, my name is Katie Ryan with Dignity Health St. Rose Dominican, and I'm here to present a friendly conceptual amendment. It's basically enabling language to allow Medicaid reimbursement payments to our Pathways Hub program via the Medicaid Managed Care Organization's administrative spend. I provided a slide deck as an exhibit to kind of walk you through the program. It's started a number of years ago. It's been very successful in other states. We've been doing it as a smaller pilot project in Nevada. I've seen some success. I think the last two slides show some of the success stories. We'd obviously like to grow the program, so that's why we're here today. It was started in Ohio by a couple that are both medical doctors, Doctors Redding, and it really is all about CHWs, meeting the patients where they are, providing wraparound services, 21 pathways. So each one of those services is considered a pathway. So it's all of the social determinants of health, essentially. If you have any questions, I'm here to answer them.
Committee members, any questions on the friendly amendment? I don't think we have any. Thank you so much. Is there anyone else that would like to testify in neutral on this bill? We don't have anyone in Las Vegas, anyone virtually.
Chair, there are no callers at this time.
Thank you so much. Do you have any closing remarks? Come on in.
Jay Colbert-Classell for the record. Thank you so much for bringing this forward again to expand the CHW program in Nevada. a couple comments on the fiscal note. I'm not sure if that program has been fully fleshed out, or if we could bring some other state representatives who designed that language and that fiscal note forward. But if there was a fiscal note, I would recommend directing those funds to the Nevada Certification Board instead of kind of rebuilding the wheel and having another investigative department. So just to put that forward. And then the final one is, even with the current program, we do have some challenges with MCOs. I haven't seen this slide deck or the friendly amendment, but the MCO unit is working on how to address some of the contract challenges that prevent the CHWs from billing their services for MCO work. So that is something that does need some effort to it. Thank you very much.
Thank you so much, sir. Yeah, as I always mention, we're the policy committee, so we'll have committee staff work with you on the fiscal note process and seeing if we commit any amendments to the bill. So we'll continue the conversations. But thank you so much for being here today. I'll go ahead and close the hearing on Senate Bill 117. We do have one more item for today's meeting before we end and adjourn. We'll go to the introduction of a committee BDR. Committee members, as you know, throughout the session, committees are asked to introduce a bill draft request to begin the bill process, assign a bill number, and to get it referred back to our committee. Just as a reminder that your vote to introduce a BDR is not an indication of support. It's just to get the bill printed and assign a bill number. Today we do have one bill, which is BDR 40-749. All of you should have a copy of it right in front of you. But again, as I mentioned, this is just for introduction, not in favor of support or any other provision. So at this time, I'll go ahead and entertain a motion to introduce the BDR. Just for everyone's clarification, the bill itself is an act relating to county hospitals. It revises provisions governing meetings of a board of a hospital trustees. It revises certain provisions related to a hospital advisory board and also provides matters to property there too. So that's essentially the bill scope. And
at this time, I'd move to move Bill BDR 40-749.
Thank you so much. We have a motion from Senator Nguyen and a second from Senator Stone. Any discussion? All those in favor, please say aye. Aye. Any opposition? Motion carries. So the bill is now going to be proceeded forward. Thank you so much. We'll go to the last agenda item, which is public comment. We'll start with public comment from those in the physical locations, and then we'll move to online. Is there anyone here that would like to provide public comment? We don't have anyone here. Anyone in Las Vegas? And anyone virtually?
Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. Any comments before we adjourn? Got the meeting done in 1 hour. Woohoo, let's go. Thank you so much for joining us. We'll see you later this week. A meeting adjourned.